Good afternoon and namaste. I am Dr. Satish Nair, an ENT and head and neck surgeon. I'm presently a senior consultant, professor, and academic head of ENT in Apollo Hospitals, Bangalore. My area of expertise is head and neck cancers. I also have expertise on endoscopic neck surgery, minimally invasive neck surgery, as well as robotic surgery. Yeah, can we have some questions?
Welcome to the Facebook Live, Doctor. Let's take our first question. What are head and neck cancers?
Well, head and neck cancers are a group of cancers that involve the area of the head and neck. And as I would say that head and neck cancers are very common. For example, the sixth most commonest cancers in the world, and they're much more common in India because of the use of tobacco and the chewing of the pan. As far as head and neck cancers are concerned, it's a matter of concern for many people because the head and neck, as you know, has areas which are involving all the five senses of a body: the eyes, the smell, the hearing, the taste, the speech, the swallowing, and most importantly, the cosmos, the face of the person. So a cancer involving any of these areas definitely have an effect on the individual. So the head and neck cancers are of various types depending on which area they are involving. For example, they can be divided into the oral cavity of the mouth, or the back of the mouth, the area which is an area involving the tonsils, which is called the oropharynx, the nose, and the area with the sinuses. It can be larynx, the voice box, where it can be involving, or the area adjacent to it where we swallow. In addition to these cancers, in these areas where there can be cancer, the other areas which are also involved, like there are some salivary glands in the head and neck, like the parotid and the submandibular gland, which can have cancers. And another important area is the thyroid.
Doctor, what are the different causes of head and neck cancer?
Well, head and neck cancers, like we say, the two most common causes are tobacco and alcohol. Tobacco just not smoking, but also due to various other methods. For example, using of the pan, the betel, the areca nut. The areca nut has some substances which keep irritating the buccal mucosa, the oral cavity, leading to cancer. So these are the tobacco causes, the pan and the zarda causes. Next is alcohol. Alcohol has a synergistic action, not just with the pan and the tobacco. It can have an additive action. So a person who smokes and also consumes alcohol has a higher chance of developing cancer of the head and neck. In addition to these, there are the other much less common ones. One is the HPV virus, which is getting a little famous nowadays because in the Western countries there's a high incidence of human papilloma virus induced cancers, cancers of the oropharynx, especially the tonsil and the back of the tongue. These are due to unnatural sexual behavior or the oral sexual behaviors leading to infection of these areas with HPV virus. So the incidence is much less in India, but the Western literature, there's a growing trend towards HPV virus mediated cancers. In addition to this, other causes, for example, if you have a sharp tooth which you have been having for a very long time and that's been irritating your tongue or the area next to it, that can lead to an ulcer which does not heal. So this chronic irritation can lead to cancer. In addition to the sharp tooth are other things like industrial exposure. For example, the nose and the paranasal sinus cancers, with industrial exposure to various solvents, chemicals, long-standing exposure can also lead to cancer. Yes.
Doctor, what are the different symptoms of these cancers, head and neck cancers?
Yes, this is an important question. What are the symptoms? Because most of us want to know how to pick up these cancers early. As we know, most of the symptoms of head and neck, the problem is they may have a symptom similar to other benign or normal condition. For example, a nose cancer or the sinus cancer, the patient may just have some nasal blockage, which may be even in the sinusitis. But then there are some few cardinal things that you need to look at. For example, a patient having one-sided nose block for a long time, blood in the nose in the secretions. So these are things which can give you an idea. Yes, a condition which has been treated for more than 4 weeks, but it's not curing at all. Similarly, any ulcer in the tongue or the mouth, these ulcers which have been treated, usually people do get ulcers and which can become normal. These are some of the seasonal variations, some are due to some of deficiencies in the vitamins, But definitely these do recur. These do recur, but they become all right after a few weeks or months. But then if you have an ulcer in the mouth which does not heal, which is on treatment, not getting okay, and 4 weeks, and you still continue to have this ulcer, you should definitely go and get it checked with your head neck surgeon or general surgeon to identify, do you have any other problem. Other than this, as I said, the head and neck is an area which involves most of the senses. So you can have difficulty in swallowing, difficulty in breathing, the change of voice. The voice box cancer can have a slight, maybe initial thing would be a change of voice. So these symptoms can also lead to an identification of whether the patient is having anything which is not normal. So what I would put it as that if there's a swelling in the neck or swelling anywhere which is not going, which on normal treatment, or there's an ulcer which after adequate treatment does not improve, you should definitely go in and get checked. One of the problems of head neck cancer is that you usually do not have pain as the initial symptom. So patient may just go on with this thing for some time, and these are all covered areas inside. So the lesion may become larger than normal and maybe in advanced stage when the pain starts. And when the pain starts, then the patient comes to the, for the treatment. So to get the patient at the earlier stage, an initial checkup for any symptom, an ulcer or a swelling which persists for a long time should be evaluated.
Doctor, what are the treatment options that are available?
Well, now, if you go for treatment options, in head neck cancers, there are the major treatment arms in oncology that we know of. They are usually surgical arm, radiotherapy, and chemotherapy. So in head and neck cancers, the surgery and the radiotherapy are the two main arms. Treatment depends on which area is involved and also what is the extent or the stage of tumor. Normally we stage the tumor as stage 1 to 4. The 1 and 2 are called the early stage tumors. The 3 and 4 are called the advanced tumors. So normally an early stage tumor requires just one modality of treatment, generally requires one modality of treatment, whether it is surgery or radiotherapy. Whereas an advanced tumor usually requires a multi-modality treatment which may require surgery and radiotherapy or radiotherapy followed by surgery. But then, how do we decide which patient requires what treatment? These are set protocols and guidelines on which area. Like for example, an oral cavity, a tongue lesion, initial lesion would go for a surgical management, whereas a tonsillar lesion would go for a radiotherapy management. So these are set patterns at different areas where we try to preserve organ and where the treatment and the prognosis are dependent on what kind of treatment you give. And we definitely go with evaluating the patient and also taking the patient into confidence, the kind of treatment that we can offer. And with the patient's idea and the guidelines available, we do offer the patient the treatment.
Doctor, is there any side effects of these treatments?
Definitely, there would be some side effects, not that there are major side effects. For example, surgical treatment in the head and neck, as I had told you before, this an area which involves the face, the cosmos is definitely one. Secondly, there's also the areas like the eye, the chewing, the swallowing, they may be affected. If you have a cancer of the mouth, then a part of the tongue needs to be removed. Even if it's reconstructed, there would be some problem in swallowing, in articulation, speech, etc. So these problems of surgery are there. As far as radiation concerned, equally radiation has its own part too. It has its, you can have a sores in the mouth for some time, maybe up to 3 months or 6 months, change in voice, difficulty in swallowing, dry mouth, and these things do, but they do improve over time, and within 3 to 6 months, usually the patient starts improving from all these symptoms.
Doctor, the survival rate?
Survival, again, it depends on the area involved. Like I told you, there are various sites like the oral and the oropharynx, the voice box area, the nose, etc. They have different survival rates. But if I generalize the survival rate, I would say, for example, depending on the stage, whether it's a stage 1, 2, 3, or 4. So generally, I would say a stage 1 has a more than 90% survival rate, generally in all the areas. A stage 2 would have to about 80 to 90%. A stage 3 between 60 to 70%, and stage 4 about 50%. To those 5-year survival rates that we're talking about. But then some place like the larynx has a better, voice box sometimes has a better survival rates as compared to oral cavity.
Doctor, what is the personalized care available at Apollo hospitals, Bangalore?
Yes, we at Apollo hospitals here follow a strict criteria. First of all, we are following strict guidelines in treatment of patients with cancer. A patient once arrives to us with history or suggestive of that, of any lesion, is evaluated by a multidisciplinary team. It's a patient may come to the surgical oncology or come to the head neck surgeon for a lesion in the mouth. He's evaluated not just by me, he's evaluated by the radiation oncologist, he's evaluated by the medical oncologist. He gets a complete picture of what the various treatment options are available. In addition, he's also evaluated by speech and swallowing therapist. He's also evaluated by a psychologist to give him support about he and his family members during the treatment that's going to happen. After a diagnosis and the treatment plan is made, the treatment is vetted and seen by the complete tumor board. We have a tumor board which looks at every case as per protocols and required. So these tumor board looks through our cases and decides what a multidisciplinary team is there. Everybody's evaluating the case and what is best is decided. At this stage, the patient is also brought into the picture. He's also explained about the various protocols that are available, and he's also agree. So there's a personalized treatment protocol that is there. The person is also included in the part of it. In addition to that, we are also following few markers, special markers for areas like the thyroid and the orophyte, like the HPV markers, the P16 marker that I said. We're also looking at these markers to identify which other cases require what kind of treatment. So the treatment just does not include it's not a single shoe fitting everybody. It's a different personalized management to each and single person depending on his requirement, what kind of a job he is doing, what are his constraints, and the treatment protocol is explained to him.
What are the chances of recurrence, doctor?
Well, the recurrence is something that I've already answered, something similar to what the survival will be. Again, it depends on the kind of treatment that is being given to the patient, what is the kind of tumor that is there, and what is the stage of the disease. A higher stage disease has a higher chance of recurrence. And again, they depend on which area of the head and neck they involve. Like I said, there are multiple areas. One of the areas in head and neck I would like to mention is thyroid. A thyroid has a very good chance of survival. We don't talk about 5-year survival, we talk about 20-year survival. So thyroid is a common condition that we find nowadays in lots of people. The thyroid carcinomas are also being found and detected much more now. The treatment of thyroid carcinoma has a very good prognosis, a very good survival. Even thyroid carcinomas which are aggressive, involving the voice box, we have treated those patients well. We have done minimalistic surgeries, excision of the tumors completely, and post-op treatment, and they're doing very well. So there are some areas which actually do well. Parotid tumors do well compared to an oral cavity cancer. So the recurrences are depending on the various areas.
Is the treatment painful?
Well, treatment, I won't say this is painful. They're definitely surgery, post-surgery, few days. You do have the time for the pain and to recover from thing. As far as radiotherapy is concerned, radiotherapy again is it's a misnomer. People think that's a lot of pain. There's no pain in it. Yes, definitely after a few weeks of initial radiotherapy, there will be some sores and difficulty in swallowing or drying of mouth, but definitely not painful. One of the things that I find a lot of patients coming to us who are worried about is the chemotherapy. They when we say that you may require some chemotherapy as an added part to surgery or after surgery with radiation, they are a bit scared about it, because the picture of chemotherapy is usually of a person with a bald head and loss of hair. But head and neck cancers really, and this squamous cell carcinoma, there is very little chance of that kind of an effect because chemotherapy is just given to sensitize the radiation. So it's in a very low dosage. It really does not lead to all that widespread symptoms like in a lymphoma or a leukemia.
Doctor, how about recovery period? Is there any specific recovery period or?
Usually after surgery, most of them, the patient is usually there for about 5 to 7 days in the hospital, maximum of 7 days, and then is discharged. The patient after that requires about 2 weeks for healing of the wounds and the thing. And if it requires an adjuvant radiation, usually we start the radiation within the 4 weeks. So the treatment of radiation by the time the wound heals can start. And once the radiation is given to the patient, there are some post-radiation effects, which, as I mentioned, can be there from 3 to 6 months. Usually involve what kind of radiation, the various better methods of radiation that are available as of today, sparing the tissue. Because earlier, we should just give radiation from one side of the face to the neck. It used to involve not just the tumor tissue, but also the tissue all around it, causing its effect. But now we have better intensity modulated radiation, etc., which 3D radiation, which just affects only the tumor and not the tissues around it. So all the side effects like the problem with the dental problem, caries, the teeth, the saliva, the decrease in saliva, all these have reduced. The difficulty in swallowing, these problems are reduced. But still, many of the patients do have some of the symptoms for about 3 to 6 months. Yeah, there's Mr. Ajit. He says of neck FNSE is lymphocytic thyroid, and it's a lymphocytic thyroid can be cured from it. Yes, so this is a lymphocytic thyroiditis. Thyroid can have thyroiditis. It's just an inflammatory condition of the thyroid. There can be swelling of thyroid. There can be some amount of hormonal changes. So in this condition, as FNSE shows it does not show a carcinoma. It doesn't require any further management surgically. Yes, it can be treated medically. So Ms. Artis talks about can neck ultrasound detect throat cancer? Oh, well, ultrasound does not detect throat cancer. Throat cancer, for example, the evaluation can be done on a direct evaluation of the throat. Next is use of endoscopy. We have endoscopes, fiber optic endoscopes, which we can evaluate just not the throat but also the larynx. And this, after we find the disease, if there is a disease, we need to take next step is usually taking a biopsy. So once a biopsy is taken, and then the next process of after biopsy, if it is put, the patient goes through a radiological evaluation. In the radiological evaluation, it's not the ultrasound, but a contrast enhanced scan that is more preferred. A contrast enhanced scan will tell us exactly what a third dimension of the tumor, where it's involving, is it spreading anywhere else, and are there any other nodes where it's spreading, if a disease is spread to the nodes in the neck. And ultrasound is a very good medium to evaluate thyroid, especially thyroid tumors, thyroid cancers. Ultrasound is one of the earlier things that we do, and ultrasound tells us now about whether we should even do an FNAC at all. So there are various set criteria. If it's done by an experienced ultrasound person, he can tell you what the lesion in the thyroid is. Does it require even an FNAC to further evaluate?
Doctor, after a sinus surgery, is there any precaution that needs to be taken?
Well, this is not in head and neck, but still part of my ENT. So I would tell you about sinus surgery. Yes, after sinus surgery, there's no specific. Depends on what is the cause for which you got a sinus surgery. Most of the time, you're getting a sinus surgery done for sinusitis or some polyps in the nose. So if it's just a bacterial infection in sinusitis, it's cured, and after post-op, your doctor will tell you that you should use some saline nasal douche, that you clean the nose clean, or put some saline nasal drops, so some steam inhalation, and the healing, it improves the healing. The saline water, etc., improves the healing. Whereas if it's due to polyps, it's usually due to allergic condition. So similarly, after or not just use this, patient may require further treatment with some medical, because it's a medical condition, an allergy causing this. If the polyps have been removed only to create some space so that the medicine can reach the area that is required, or it's just clearing the nasal blockage. So finally, the patient will require to come back to some medical condition, medical therapy for if it's an allergy condition. As we know, the thyroid is a very common condition nowadays. And to say if you at the age of 50, if you do an ultrasound for people, 50% of people will have some thyroid nodule. But that does not mean every thyroid nodule is cancerous. Well, the other thing is most of the time you find thyroid in ladies. So you have a lady coming with a thyroid swelling, and she's worried about the swelling, not just for the cosmetic purpose, but also whether it's cancer. Well, there are set patterns by which we can identify. We can, like I said, the ultrasound of the neck, the thyroid gives us a very good idea of what kind of lesion it is, if it's a benign condition or cancers, or an FNAC further proves that. One of the problems with the thyroid surgery is a scar in the neck. Many of the people do consider that, exactly right in the front of your neck where you should be wearing a necklace, you're having a scar. But then we do have methods by which we can do a minimally invasive technique by going, from a scar which is remote access, that is behind the ear at an area and the hairline, or from the chest wall. We can use endoscopic methods and not have a scar at all. Similarly, in Apollo Hospital, Bangalore here, most of our parotid surgery, which requires a scar which goes all around the ear here, which is actually right on the face. We are performing surgeries through incisions right in the neck, in the hairline. The scar is not visible at all. So these are the cosmetic, little personalized treatment that we're following for these patients. Um, so there was a question on okay. What about reconstruction? Like I mentioned, the head and neck cancer is an area which is involving for cosmetic purposes as well as the senses. So after surgery, what happens? If you take a part of the tongue away or the palate away, what happens to the patient about swallowing? So rehabilitation, reconstruction followed by rehabilitation is a major role in head and neck cancers. The reconstruction, we have various methods of reconstruction as of now, not just the primary closure of the wound to even microvascular transfer. So we can have a free tissue taken from any part of the body and fixed with the blood supply into these areas to reconstruct the defective area, the area that have got a defect. Not just the reconstruction that's important, many of the patients also go through a prolonged time for rehabilitation. For example, cancer of the throat or the oropharynx, there's a lot of swallowing problem, not just speak, but also swallowing problem. So patient needs to be taught how to swallow. There's a swallowing therapist with us who sit with the patients, take them slowly through the various swallowing techniques and rehabilitate them.
Doctor, what's the advice that you would want to share with the patients suffering from head and neck cancers?
I would say, first of all, if you have an ulcer or a swelling in the head and neck area, which is persisting, please do consult a doctor. Please don't leave it. The doctor may advise you for biopsy. Please get it done. So, uh, a node in the neck, a lump in the neck, or a swelling, or an ulcer in the mouth, unknowing bleeding from the nose or the mouth requires a thorough evaluation. As far as treatment is concerned, there is, as I mentioned, the surgical arm is there as well as the radiotherapy is there. The treatment depends on which is the area which is involved and what is the stage of the disease. Many of the treatments have very good, especially the early stage disease, have a very good result. They have good results as compared to an advanced stage disease. So, knowing the cancer, knowing the disease early, knowing the symptoms early, and getting evaluated makes a great way in treating these cancers. There's a question on whether head and neck cancer is painful. I think I did mention that. The problem, most of the head and neck cancers are not very painful. They may just, prolong with a difficulty in swallowing or a change of voice, slight change of voice, a feeling of lump in the throat. When they swallow, they say, no, I do have a little bit of problem in swallowing. A small ulcer in the cheek or the tongue, which has been there for some time. Usually they become painful once they start invading and they become larger or they grow to other areas. So that's the time when they actually become painful. Maybe that's the reason that many times people come late to the for evaluation as compared to other cancers. Anything else you would like to? Yes, Mr. Bhaktullah has asked, I have nose allergy. Okay. So, though it's not part of head and neck cancer, but still, I will comment on this. No, nasal allergy depends on which age group that you have it in. It can be a perennial one that is throughout the year, or it can be intermittent, or it can be just episodic. That is, you get exposed to a particular thing and you have allergy. And many of us do have some allergies exposed to a particular thing, but then it goes off immediately. One is a seasonal one. You have a particular season, then you have allergy. And the other is a perennial. That is, throughout the year you have nasal allergy. Some of the symptoms of nasal allergy are typical nose block, watering from the nose, itching of the eyes, nose, throat, ears, uh, and a lot of sneezing. You get up in the morning and you have 15, 20 sneezes. These are the problems that the patient do have. A nasal allergy is a medical condition and needs to be treated by medical. Some of the things that are most commonly prescribed for a nasal allergy is an intranasal steroid spray. Others are antihistaminics, which can also be used with it. An intranasal steroid spray is a safe medication which can be used from the age of 2 years onwards in a lot of people. And use of them has a very good effect on the symptoms of allergy. But then the allergy is not cured. The symptoms of allergy are reduced. The patient's quality of life improves. So as long as you use the sprays, you do have their effects. But maybe once you stop using the sprays, then the effects go down. So you should just show yourself to a ENT doctor. He would definitely have a look at you, maybe do a nasal endoscopy, evaluate you, and give you this treatment.
Doctor, thank you very much for taking all our questions and giving us a lot of information and clarity on how to be handling a lot of cancers and the treatments available. Thank you so much.
Thank you. Thank you very much.